Antibiotics, vaccines, and other animal health technologies are critical tools that veterinarians and farmers and ranchers use to raise healthy animals. The proper use of these technologies is critical, not only for the effectiveness of the compound, but also to the overall health and well-being of the animal and safety of the dairy or meat product. The improper use of veterinary pharmaceuticals, vaccines, and other drugs in food-producing animals has the potential to leave behind residues that may be harmful to the consumer. For the purposes of this module, a residue refers to the presence of a pharmaceutical or vaccine-related compound in meat or dairy products. Antibiotics are one type of pharmaceutical administered to an animal to prevent, control, or treat disease caused by harmful bacteria. Any animal that receives antibiotic therapy cannot, by law, be sent to slaughter until the drug has been reduced to a specified level and deemed safe for human consumption. Drug concentrations above this level are illegal and known as violative residues. While the number of violative residue cases is minute, it is essential to exercise best management practices in order to prevent violative residues from entering the food chain. Viewing these videos will help you gain a better understanding of residue avoidance best management practices. What is a drug residue? A drug residue refers to the presence of veterinary pharmaceuticals in any edible portion of the animal product, including meat, milk, or eggs. Residues are not just limited to veterinary pharmaceuticals such as antibiotics and dewormers. Other chemicals, insecticides, vaccines, or other products given or applied to food animals can be sources of drug residues.
While the antibiotics won't show up in her milk, it could still show up in her tissue. And so that is something that as a dairy farmer we're aware of. And every antibiotic is labeled with the appropriate time necessary for holding.
Why are drug residues an important topic?
Veterinarians are on farms every day, working with farmers to ensure the health and wellness of their animals. However, just like us, animals sometimes get sick. When they do get sick, farmers work with their veterinarians to ensure that animal is treated with the proper medication and that all proper withholds are followed before that animal would ever enter the food supply.